So an understanding of the importance, and there's two of us here at the screen, so we're just going to change the slides. I'm just going to click forward. So a repeat of how the RSCGP works now, and the KISS standards. Now, Trish covered last week also around risk. So essentially, with risk, it's a way to frame conversations as well. So, for example, most general practices do actually have an incident reporting form, and that sort of support is available for you because the KISS standards come with a workbook, and in the workbook are a lot of practical templates for you to assist you with these matrices as well. So in a risk setting, so we've got this word governance here, and really what that governance is actually a way of saying if a general practice has an incident reporting form, so if something occurs, it's reported. For example, the the external hard drive with a backup has been misplaced, no one can find it, that's reported. So a form of reporting. Governance itself also says, have you completed the matrices within some reasonable time frame? So currently the driver often is the accreditation that happens every 3 years, but perhaps the practice moves to a place where they're comfortable mapping the KISS matrices per annum, and therefore governance would say, yes, we have gone ahead and looked at all of the KISS matrices, and we've noted that there need to be some updates perhaps to policies, or perhaps policies don't work the way in which procedures work within that practice, so we're going to make those amendments. And so in this very small and incremental way, the practice is improving its information security. So the third thing is, so around governance is really reporting incidents. Yes, we're going through the KISS matrices and we're mapping and we're improving performance. And the third one really is, monitoring and knowing what's happening in a network. Now, often that falls to IT support. So again, the matrices allow that conversation to happen. So you can take the matrices to IT support and actually say to them, look, what sort of monitoring are you doing? Because in this KISS matrix, here's a reference to monitoring or log monitoring that's required. So as again, it's a conversation and it's an ongoing process and commitment really to an evidence of culture within a general practice. Okay, so we'll revisit governance. I think most general practices are familiar with words like data governance and other forms of clinical governance, etc. So usually means a lot of work. Okay, so let's have a look. Just a repeat from last week, there's 12 standards plus the Australian Privacy Principles, which is an addendum, number 13. And we've identified today that we were going to have a conversation around policies. So from last week, when Trish was, she opened it up to questions, people raised business continuity, policies and training. Those were issues that were raised. So when we look at backup, which we're going to go through, backup requires some sort of policy, which most general practices have something in place around that, and they have it embedded into their business continuity as well, and what sort of training is there required around backup. So it sort of covers the points that were raised from last week. But I think what I'm going to do now is I'm actually going to unmute you all and ask you if you have any questions. So just give me a moment. There's an interface here that has been minimized, so we're just opening up some tabs. Yep, I'd probably be going to attendees. Yep, there we go. Just I'd try and mute all. The computer says no. We are clicking mute all. Perhaps this is a sign. I shall continue. I shall continue and say, there we go, one by one. Can anybody speak? Can anyone? Yeah, we'll call for some additional technical support here. And I'm going to continue. Someone's got my mouse. Can anybody, is your microphones off? We'll move on and we'll call in our support from the next room. Okay, so we started a little bit of an introduction. I'm just going to move across to slide 7. So today we're going to look, as we've said a few times, policies, backup, and the physical aspect. Now, again, these matrices are available if you Google RSCGP KISS, and we do have some screens on there. Now, again, the way to really frame, to look at policy is actually to have a practical example. So if you forgive me, I'm actually just going to move forward through to information backup. Now, within practices, this is, I've discovered, fairly mature in terms of what practices are doing with backup. And here's your matrix. So if we just take a look at, and I hope it's clear for you, I've got my book here. If we take a look at level 4 on the backup matrix, and we following each row, so 7.1 says policy content, and level 4 says a complete written policy periodically reviewed. So, and level 5 would be that it was reviewed annually. So backup being, as I say, important to the business continuity of the practice, that would be something we'd be taking a look at. So when we review the policy matrix, we might think then around backup. So for example, are all of the KISS matrices one policy, or are there 13 different policies? You know, those are the sorts of questions that practices need to ask and develop. Communicating that policy, so is it clear to everyone around what's expected within the practice, the frequency that it's expected, understanding of the type of backup and what is utilized. Backup encryption, which is a really interesting one. If you're using an external hard drive and it's plugged into the back of a server, quite often it's not encrypted. And so what that actually means is that if that hard drive is lost and someone plugged it into their computer, of course, they could read that information. So those sorts of things also fall under the APPs. Reliability of backup. So again, we're looking at level 4. You've periodically checked that you can actually restore from that backup, that there aren't errors in it. You've made decisions around your rotation. Is it every day and every week and every month, and how those are stored? So stored off-site quite often means the external hard drive is taken physically by a person or a company is used for that. The type of media you're using, and that varies across time. People are using different media. You would consult with IT support if you wanted some advice around that. So when we're actually looking at backup and we're saying, well, what sort of training might people need around backup? Well, what is the backup initiation procedure? From last week, we spoke about roles and responsibilities. So somebody would be assigned that task. I know at the hospital that I worked at, they wanted the backup at the late end of the day. And as a lot of the ongoing staff started at 7 to 3 and they were staggered, quite often that backup was actually left to a casual person until one day we discovered that, you know, there's 70,000 patients, but actually the backup hadn't been done for a week. So, and then it turned out that actually the casual person hadn't fully actually comprehended the enormity of that task. So those sorts of conversations within the practice, trying to capture the most efficient way the data of the day, but then also having it to be a reliable system that's communicated, there's procedures around that, etc. So this is a pretty good example because, as I say, backup in most cases is quite matured, and people do understand those obligations around that. Right, and so we move through those areas, what to back up, how to back up, the reliability of backup, testing your restore of backup. You're quite reliant at this point on your IT support possibly. And again, the matrix allows you to go to IT support and say, well, we'd like to actually, we aspire to be mapping to this level 4 because we want to demonstrate best practice around backup, for example. Could you explain what's the best way for us to do this? How should we be doing it? What happens within health IT and within the industry, and what's the best way for us to be doing that? So opening up those conversations around security aspects. We've spoken a little bit through media choice, and again, that's practice specific, size specific, and you'd definitely be looking for some advice on that possibly from your IT support. So I'm going to actually just jump back, and I apologize for doing that to you. And I'm going to jump back actually this time back to policies. So we have raised policies a little bit, and we're saying, well, how many policies do we need, and what does that mean? So if you look at the policy matrix on the next slide, the policy matrix defines level 3 as the minimum requirement for this matrix, so for the standard. And so if we use backup as an example, when we go through this policy matrix, so policy content, complete written policy. So we're saying, well, if it's in regards to backup, is that completely documented and written? Has the policy been communicated to the relevant team members? So it's been put, the team members have agreed to it, it's been written into their job descriptions, they know the processes are documented, they know what they need to be doing. Compliance indicators, we've got here 70% completed, so you're looking at, well, what sort of coverage do we have around policies? Now, I know from the general practices that I've spoken to that quite often general practices have practice manuals that quite often are quite detailed around things like backup, things like clear screen policies and physical security and those aspects. And thinking then around whether the practice manual is more of a procedures manual and is it a policy? And so again, saying, well, policies need to be workable within the practice and document the core aspects that need to be completed. So if we look at a policy possibly for information backup then, so you can see these matrices are kind of working also interrelated together. You would detail in that sort of policy that there's some policy content. So, this practice, what our backup performance routine is, what type of media we're using, who's responsible for that, the name of that person. You might possibly detail these things. So policy content, communication of that policy, policy enforcement, any terms of definition that staff might need around the policy, and then making that policy available to the practice staff. So that's 3.3, the compliance indicators. Practice team members, of course, are trained. There's been conversation around it. They understand the importance of the role and they understand how it links to business continuity. And in fact, things like data and having readily available data often is critical and directly relates to patient care. So most people would be, aware of that. External service provider agreements, and of course the PCHR has been covered in that policy and the requirements of that PCHR. And that maps a little bit also to the APP conversation that we'll have next week. So the practice, therefore, will take a look at policies. Now, I have spoken to a number of practices recently this year, just within a research context, and I'm aware that that they might have detailed the processes, but there are very few practices actually that have information security policies that they've implemented. Now, there's a lot of support for general practices out there, and you would be looking at your key organisations that you already utilise for this sort of support and advice. So the RACGP would be one, rural health another, to actually gain some support on that. And of course, speaking to your IT support people too. So how do policies fit in? At the very base level sits the policy. What do I need to do? And the standard is, well, what is required? And your procedures are, how do I do it? So procedures will detail that. And of course, the guidelines, where you get additional information around what's required, would actually allow you to look holistically at implementation of a matrix and a standard. So another thing around, of course, media is how do you discard of media, which comes also into the physical aspect. So let's take a look at the physical security. Now, most practices, so our practice manages and maintains our physical facilities, our computer hardware, the software.
Muted. Unmuted.
Or some sort of systems around that protect the practice. But when you actually start adding things in like hardware and software and operating systems, then that becomes a fairly large call. And again, it's the IT support that you're looking to. And the matrice allows you, so you're looking at the standard 11, that would allow you to have the conversation to actually be able to complete that. So you're having the conversation with IT support. What I did actually want to point out is there are, in countries like the US, there are mandatory data breach laws, which we don't have in Australia per se at the moment until it's over a certain breach. But that evidence one can get a report of online. And when you actually look at data breaches, so I looked at the 2015 data, it falls into 6 categories roughly. But when you look at reported breaches from medical institutions, including general practices, so in the US, but we can actually apply that and say, well, perhaps the same could apply to Australia. 82% of reported breaches have been human error. So that human error is either accidental, so a person didn't know, so accidentally lost the backup, nobody knows where it is. And unfortunately intentional. So there's definitely intentionally reported breaches. And only 15% are malware. So 82% are human error around computer security, and 15% are malware. So it's kind of surprising because it actually details really that information security is both technical and human, and that both of those aspects are important. So this is what the KISS actually does. It allows the general practice who are actually responsible, so they have compliance criteria they need to meet, so legal compliance, accreditation compliance. It allows the practice to take ownership of that. So they take the RACGP KISS and they say, well, if computer security is also done by humans as well as our RT support, and the practice is accountable for doing it and having some evidence around doing that, then the matrices are a great support in that area. So again, you're having conversations and structured conversations. Sometimes, and when you're unfamiliar with it, it seems like it's going to be a time-consuming endeavor, but if one committed sort of every 3 months, you were going to meet for an hour with RT support and you were just going to work your way sort of systematically through the KISS standards, then the practice would see what was achievable in those timeframes and possibly more achievable than one might have thought. So I'll give you an example. I was sitting with a solo GP, and the GP was responsible for the IT computing systems. And I sat with him. He had the 13 matrices, and he went through and he ticked them because he knew the answers. So he knew what he was doing around each of these matrices. And he went through mindfully and he ticked where he thought he mapped. And I watched him complete it in around, I guess, an hour to an hour and a half. Because it was a small practice, there weren't a lot of network systems, etc. You know, it may well have been simpler for him to do that than it is inside of other practices. So we won't trivialize the task, but mainly just to give you a vision of how that it might be manageable within a practice. So let's have a look at the physical then. I'm turning to it in my book. You've got it up on the screen. So perhaps after the webinar, you might jump onto the RACGP website and download these. You might well have done already. You may well be looking at them while I'm talking to you. So the standard 11, the physical, the minimum level is 4. It's defined at level 4. So we can see that it's a fairly important aspect. Another thing about these matrices is that each row, so activity, like a policy content, 11.1, each row is not necessarily equal, but accumulatively they're important. So there isn't a way of saying, well, overall for standard 11, we map to level 2, because the rows or activities are not necessarily of equal importance. So sometimes some aspects are more important than the others. So if you look at 11.6 and you look at confidentiality, it's also mapped to a minimum level 4, but we know that confidentiality is a requirement in the APPs. So that aspect of, and of course things around clear desk policy, screensavers, etc. We all know that those are important aspects of this particular standard. So what you're aiming really to do is for each of the rows, so 11.1, 11.2, you're looking to actually be able to map to level 4. Now, initially, that may not be the case. You may actually find in a lot of cases you are mapping to level 1. Well, that's not so bad, actually, because 1, you have now taken a self-assessment audit of where you're at. You have evidence for your next accreditation as well, because it maps back to the compliance checklist, which Trish went through last week. So you would complete standard 11 here, and then you would go to your compliance checklist and actually complete it on there. So if the practice is aware that they're mapping to level 1, then what the practice will do is look through, for example, the standard 11 and say, well, we really need to be at a higher level of compliance with confidentiality, 11.6. So the practice is going to pick 1 or 2 manageable tasks or activities, and in the next 3 months, we're going to ensure that we are going to focus on those tasks such that we can move towards the minimum level 4, so the practice is more compliant in that area. So if we pick 11.6 confidentiality, again, this particular area of clear desk and understanding confidentiality is fairly well matured within general practices. So it's a nice example that you can relate to. So if you found that you didn't have screensavers, or, as can happen, new staff come on board, you've got to train the new staff too. Perhaps they haven't worked within general practice previously. Perhaps staff like to tailor their screensavers on their desktops. Perhaps they're not aware of the importance of this particular aspect of compliance. So again, they're those human aspects. You know, although staff in general practice, I find, tends to be relatively stable, or people stay within the same industry sector, of course there are new staff that do come on board, and again, as laws change, so the APPs and the PCEHR and those sorts of compliance factors around laws, as those change, then there's a requirement also for general practices to be able to update the staff around those. So that's the goal of these RACGP KISS matrices, is that this has been thought about it has been documented into this matrix, and it is your guide to what's required. Of course, around legal compliance, you're definitely going to go out and network and read the documentation yourself, such as the APP, to see what is applicable to your general practice. And for most general practices, you are out discussing and talking to other practices around all sorts of things, including computer security, but around training and that sort of thing. So initially you map yourself to level 1 and you say, well, we're going to focus on increasing that level. We're going to do what's required to meet level 2. So we're going to do what's required to meet level 3, and we'll aim perhaps in 3 months' time that we'll be able to actually map to a higher level. So you've got some sort of demonstrated and documented improvement in practice. So your first iteration would be a baseline, and across time, so perhaps a year or 2 or 3, you can actually demonstrate by literally ticking off the boxes on paper if you need to. You can demonstrate at accreditation that you've improved around this area of information security. So something that is manageable within the practice, it works within the practice. Myself and everyone who's familiar with general practice fully understands the demands and workflows, the trust environment. We understand that sort of thing. When I speak to practice managers, they tell me, I just cannot imagine how I would fit in a security meeting. I already keep my staff back after work. I have to buy them dinner to keep them happy. And we have a staff meeting. How am I going to add this onto my staff meeting? So it's about finding a way to make that workable, and being aware again that it's not only legal compliance, but it's also the fact that health information is attractive, in the sense that it holds possibly financial data, but it also holds personal details. And the issue with that is that if you could accumulate sufficient information around people, you could apply for credit in their name. So it has the same sort of risks as other data from other organizations. And I also think, I speak to, I'm a patient myself of a general practice, and I think to myself that I have an expectation that my health information is protected. So there's also that, from that perspective, that patients have certain expectations. So within the KISS workbook that you would have downloaded, you'll actually see that there is a little section on policy content. So there's some written guidelines around the matrices. So it's not that you've just got the matrices, but you've actually got some written support there too, inside of the book. And absolutely don't forget the workbook. The workbook is fabulous. The workbook gives you a whole lot of templates around recording your information assets, your hardware. It gives you templates around backup and those sorts of things. So there's certainly a lot of information there for you to support you. So it's a starting point for yourselves. So let me have a look. Secure disposal, well, I guess 2 ways. You're either going to take your hammer and you're going to destroy it with your safety glasses on, or you're going to run a bit of software that erases or clears any sort of media that stores data. So without needing to know technical details, because you'd be speaking to RC support, essentially there's secure software like Eraser out there, but you'd have to run it about 35 times, because from a forensics perspective, if you just ran one cycle of erasing, you could still run forensic software that would pick up that data. So the whole area of forensics has grown immensely in recent times. So again, not too difficult to get yourself a little bit of forensic software, pick up some either computers that have been thrown out of a general practice, or pick up hard drives that have been dropped or lost, etc. So being aware that secure disposal of hardware also requires some thought. And again, one would definitely be expecting that perhaps IT support would assist and understand the importance of that. Now, we said that this is a fairly large category. I've actually closed my book already, but we're looking at software maintenance. So what we're saying here is there's a lot of literature out there that says that you just really need to do possibly 5 main things to be sort of 75, 85% secure. And certainly one of those is keeping your software updated. So if you're on a Microsoft system, we got Patch Tuesday. I turned my computer off today that I turned off yesterday, and suddenly I had sort of 55 updates. And I say, really? So it really is about regularly updating. Again, quite often that's done remotely, automatically, or done by your IT support. But it's definitely worth asking the question, are you doing it? How often do you do it? What's your system for doing that? So actually having the practice who is accountable for protecting that information, using the matrices to have conversations with IT support around what those expectations are. So it gives you the questions to actually ask IT support. Now, I've heard it said, that there isn't, good health IT people out there. And I've heard it also said that 80% of what IT support do for general practice or healthcare is the same as you would for any other organization. So really it's just about identifying finding an IT support that fits within your practice. So you're hiring them by the hour. And if you're hiring by the hour, ask them, are you aware of these KISS matrices? Go to the RSCG website and go and get them because the KISS matrices cover both the technical expectations as well as people checking that those things are done. So it opens up that conversation for you. So very important that your operating system and, of course, the software is updated. So you're patching it, you're keeping it up to date. Right, I was thinking I'd leave 20 minutes for conversation, so hopefully we can unmute you. So take each standard one at a time. A massively daunting task if it's outside of your knowledge area. So it's an addition to a very busy job, a job that has already a lot of expectations around patient care, clinical governance, and other expectations. So the sport is out there for you. Have a very systematic approach. Pick the ones that you feel you can do. So if
Muted.
because we're going to take a look at business continuity. So with backup as part of that business continuity, so we can carry on with that conversation then next week. So you can benchmark where you're at and how you're tracking. You can make incremental improvements. In fact, you could also go to practice owners and say, look, we're mapping here at level 1, level 2. The practice would like to identify just in one area with one standard, like we'd like to improve how we perform, but we're going to need some money for training staff. Perhaps the matrices also gives you the ability to go to management and be able to show them some evidence around how you're performing in your compliance with information security and putting a justification forward for saying, yep, can we have a little money for training staff or etc. So it opens those sorts of conversations.
But the UK factor did not come in there last year.
All right, so webinar 3, as I mentioned, we'll look at business continuity. What I'd really like you to do is probably go and download that, print it off if you want to, and actually map yourself against business continuity so that when we have webinar 3 next week, you would have some real application to actually doing that matrices. So that would be great. We'll look at information sharing and quite importantly at the Australian Private
afterwards.
Okay, right. So I think you're being unmuted. Is that correct? So I don't think I can hear you. Does anybody want to talk? Does anybody have a question? Let me have a look. Do I have a question?
Well, it's an info.
You know what? I recognise your voice from last week.
Next day to claim the UP today.
Can I ask you to ask that question again? Go ahead.
Okay, continue to January 15.
So there are 8 people online at the moment. There were 9. There's 8 people online. Have what I've been saying, are there any questions around what I've said or comments?
So this one here, and that was done 3rd of February, is could it be the one for?
We're having a lot of fun on this end here. So I don't hear any questions. We're just going to see, we've got another moderator online. We're just going to ask her.
Okay, 29th of October 14. Okay.
Can I ask you if you have a question, possibly to type it actually, because we began today with a few technical skills. So if you have a question, can I ask you to type it for me now?
That day. But once the patient is seen maybe after that day, that claim can only be made for that particular period.
I also want to mention that we are open to questions. If you find that during the week or you're mapping your business continuity, and you have some questions that you need answered in advance, or perhaps there's something around what I've discussed today that you want to ask about, perhaps you go ahead and you map your backup to the matrix and you have a question, please email it through to Rural Health. We're more than happy to address those questions. Sometimes when you're the speaker, like myself, there's something you may have overlooked. So very interestingly, from last week, we had questions around business continuity, policies and training. And so those were the things we were trying to focus on today. There's no questions being typed, so I have no one asking any questions. And so what I'm going to assume, so I do hear a voice online, but I don't think that person's talking to me. What I'm going to assume, it is now 1:44, I'm going to assume I don't have any questions from the 8 online. Again, you're welcome to email through to Rural Health if you have any questions. Okay. So I think, therefore, we shall call the webinar finished. Enjoy your day and enjoy your week, and tune in next week. Bye-bye.
I'll discuss with you.